Long-Term Care by Mariah Hubbard. The need for long-term care is identified by physical and mental disabilities that impair functioning in activities of daily living, regardless of age. Examples of these activities include eating, toileting, mobility, bathing, and dressing. Since elderly people are at higher risk for chronic disease and disability, they are the primary recipients of long-term care. About two-thirds of the United States elderly population need assistance with personal care. Other vulnerable long-term care subgroups are the non-elderly disabled, the developmentally disabled, and the mentally ill. Long-term care includes medical, personal, social, and psychological services provided to chronically disabled persons over a long period of time. Long-term care may be received through the home, from a health agency, or from family and friends, in the community, or in residential settings. About two-thirds of all long-term care service providers are in residential settings. The cost of long-term care varies depending on the type of service needed. The United States healthcare system is not meeting the needs of the elderly and disabled that need assistance with activities of daily living. The center of concern for long-term care services is cost coverage. There are several issues pertaining to long-term care policies that all seem to arise from cost of care. Major insurance providers are not coordinating their policies so that recipients can afford care. The distribution between the two largest providers of long-term care, being Medicare and Medicaid, are imbalanced and causing negative consequences to the healthcare system. The elderly withholds the majority of the needs for long-term care. However, it is seen that most do not financially plan for this type of care. When professional care is not accessible, a lot of the responsibility is passed down to the family members and friends that manifest into more trouble. An increasing demand of long-term care services is greatly influenced by the population growth in society due to the baby boomer generation and the reduction in supply of informal care. Another influence on the concern of long-term care policy follows the disjointed array of funding strategies that include private funding and private long-term care insurance. The aging baby boomer generation is putting a lot of stress on the healthcare system. Because of the baby boomer era, the population is bound to become much older, with the number of citizens over the age of 65 projected to more than double. A baby boomer has a 70% chance of needing long-term care services, and majority are unaware that the probability is that high. A big issue that heavily impacts Americans is the lack of planning for funding long-term care. The average retirement saving for the boomer generation is $75,000. Social Security payments that retirees receive only provides income for basic living expenses, and that is it. A single year of nursing home care costs over $80,000, and the cost is still increasing annually. A consequence to the lack of preparation for long-term care funding typically falls into the hands of family members and friends. Although most people want what is best for their elderly family members, being the caregiver can be a burden on the family. Family and friends provide majority of long-term care informally and without pay. This type of stress on the family can lead to a high risk of financial instability, emotional instability, health issues, and a negative impact on general well-being. Support from family and friends is sometimes not enough to fulfill the needs of a person who needs assistance with daily activities. Efforts to care for their family members who need assistance contributes to reduced household income due to significant time and attention away from work. The cost of long-term care is a nationwide issue that has been in reformation for decades. Nationally, long-term care is paid for from 63% of government payments, 22% of out-of-pocket spending, 9% of long-term care insurance, and 2% of private sources. The major sources of funding for long-term care are Medicaid and Medicare. Although Medicare is the number one program for citizens 65 years and older, it has a minor contribution to funding of long-term care compared to Medicaid. Medicare covers medically necessary care for acute care, such as doctor visits, drugs, and hospital stays. The only long-term care Medicare pays for are services needed after hospitalization. which only covers a certain amount of days. Medicaid is the largest and primary payer for long-term care in the U.S. The overuse of Medicaid is threatening the original purpose of the program. It has become a default payer rather than a safety net for the poor. Medicaid favors the trend of home-based and community services, meaning a lot of institutional facilities are not covered by Medicaid. This has led to programs being typically underfunded and long waiting lists for services. Another big contributor to the funding of long-term care is long-term care insurance. There are currently 8.1 million individuals who have some form of long-term care insurance. Several reasons are seen common for citizens who do not have long-term care insurance. These reasons include denial about the possible need for future nursing home care, lack of knowledge of potential long-term care service needs, and false assumptions that their other insurance or Medicare provides coverage. The issue with this program is not only the lack of knowledge, but also the rejection rate. 20% of long-term care insurance applicants are denied coverage due to personal health or family health. The major issues of recent long-term care policies greatly impact the three aims of the healthcare system. America does not do a good enough job to provide citizens with program options that are beneficial for the quality of care. The cost of long-term care is too expensive for a majority of Americans. Better coordination between the big insurances and programs that aid long-term care can potentially reduce costs and greatly enhance patient outcomes.